Hello, everyone. I'm Dr. Sheila Segerson, Director of Shelter Solutions at Maddie's Fund. Welcome to Maddie's Monthly Behavior Connection, a monthly webcast where we learn about topics of interest to those of us who are interested in animal behavior, providing support to keep pets in homes, or supporting pets while in shelter or foster care. Our guest today is Tom Candy. Tom, whose pronouns are he, him, started volunteering in rescue at the age of 15 and has been involved in a variety of aspects of rescue since then. He obtained a Bachelor of Science degree in bioveterinary science and then a Master of Science degree in clinical animal behavior from the University of Lincoln in the United Kingdom. Since graduating, Tom has been working at the UK's largest dog welfare organization, currently as a senior training and behavior advisor, where he supports the training and behavior teams across the Southwest United Kingdom. Tom is a certified clinical animal behaviorist with the Animal Behavior and Training Council in the United Kingdom, a certified canine behavior consultant and certified shelter behavior specialist with the International Association of Animal Behavior Counselors, and a member of faculty and also certified with the Grisha Stewart Academy. Tom also runs Simplifying Shelter Behavior, a Facebook page and podcast dedicated to bringing up-to-date, positive-based training and behavior tips and tricks to shelter and rescue staff and volunteers. Today, Tom will be talking to us about a topic that is in high demand, behavior modification plans. Welcome, Tom.
Thank you for having me. I'm really pleased to be here. I think Maddie's Fund is such an amazing resource, so I'm really glad to be able to share with you today. For this presentation, we are going to hopefully try and use Mentimeter. So I'm just going to put a web link in the chat, and then there'll be a QR code to scan when we get to it as well. So I'll explain a bit more when we get there. I'll just share my screen. Okay.
That looks great.
Perfect. Just for the people watching, if you're watching this on the recording as well, we're doing this in December, so I've included a couple of Christmassy pictures, so apologies for that. But if you're watching it live, hopefully you'll enjoy them. So we're going to be talking about creating BMPs, so behavior modification plans, and particularly looking at a model called the Happier BMP, which we'll explain as we go through. But our learning objectives for this session are to understand what a BMP is, consider how we can approach development of happier behavior modification plans, discuss the elements of those happy plans, and then think about smart targets and goal settings as well. And this talk really is for shelter and rescue, but it will work as well if you've got dogs in foster homes and that sort of thing. And hopefully that'll become clear as we move through. But we're considering a lot of factors that make doing behavior modification in shelter and rescue quite challenging. So the first question that we've got to answer is, well, what is a behavior modification plan? And unsurprisingly, as it says on the tin, a behavior modification plan is something that we do to modify a dog's behavior. It'll often be individualized to specific dogs, so we want to look at the dog in front of us and create a plan that's going to meet their needs and their background so that we can change their behavior effectively. We might also have some standardized plans, and they're helpful to reduce the amount of time we spend writing plans and can be useful to kind of get stuff started, but often we might need to just tweak them down the line to make sure we're getting the best effect for the time that we're putting into these plans. And often, or I would actually say now more often than not, we're looking to change the emotion as well. So we're not just considering behavior as an entity by itself, but we're looking at that holistic approach. So behavior modification plans should consider things like the dog's personality, temperament, and health. So again, that overarching picture of that dog, not just looking at the behavior itself. The severity and the risk of the behavior that we're trying to modify, triggers for the behavior, the environment the dog is in, and setting goals and recording progress. They're the kind of things that we really want to consider when we're looking at our behavior modification plans. We know that dog trainers enjoy an acronym, so one model that we can use when we're thinking about our BMPs is our Happier BMP model, and that stands for health, assessment, planning, prognosis, which is our expectation setting, investing in emotional change, environment, and record keeping. So we're going to sort of briefly cover assessment and health before having a look at a model called the 3Rs, which can sort of help us with our planning and our investing in emotional change. And then we're also going to talk about our prognosis setting and our record keeping in the form of SMART goals. So that's sort of our plan for the next hour or so. So starting with health, this is hopefully where our first Mentimeter is going to be involved. So if you have got a phone or a tablet, just get that ready for the QR code in a minute. But the reason that we want to consider health and the reason that it's at the start is often we know health can have an impact on behavior. And we always want to consider it as the starting point, because if we don't address any underlying health concerns, that's going to stunt the progress that we're able to make. So it's easier to kind of try and rule that out early doors. It's not always possible, but we're just starting to investigate these things. We know that pain can be involved in lots of behavior, especially where we see sudden change in behavior. So something that we haven't seen before from that dog, or where the dog is reported as Jekyll and Hyde or is unpredictable. So where we see this kind of differing behavioral response in different situations. And really any case where we're seeing aggression or considering aggressive behaviors, we want to be thinking about pain and medical in the back of our minds. There are different diseases that might also affect how our dogs behave, our gastrointestinal issues, different things like that, which is obviously important to consider with the vet, and any medication that the dog's on. And that might be working alongside a veterinary behaviorist with psychoactive medication, or it could just be using general medication. So, for example, steroids often make dogs hungrier, which obviously might affect some behavior things. It's why it's really important that we're having these discussions with our vets before we then start changing and tweaking things when we're working with our dogs. So hopefully this is going to work. So if you scan this QR code, or you can follow that link in the chat, and you should be able to answer the question, what are some signs of pain that we might see in our dogs? Let's check the chat and see if it's working. Hunched gait, yep. Hunting and restlessness, that's a really good one to watch out for. GI issues. Well, that's helpful, isn't it? The QR code blocks it. Limping and lack of movement, wincing, whining. Oh. Yeah, so some really good ideas coming through here. And these are all things that we might want to record or keep an eye on and notice that we can then flag to our vet teams to have them further assess whether pain is a contributing factor or potentially not in that case. Once we've ruled in or out health or
Tom?
medical issues. Oh, yeah.
Sorry to interrupt. You have a gray box. So I think there's something lying right over. Yeah, that box right there. Thank
Yeah,
you.
there's the chat. Sorry, thank you. Once we've sort of ruled in or out our health thing, we can then consider the assessment. So really, assessment is our foundation of behavior modification plans, because we want to make sure that we are addressing core factors and not just trying to train out behaviors. So when we think about assessing behavior, there's four sort of main questions that we can start with and try and answer in the early stages. So that's first the context and generalization level of the behavior. So where's the behavior happening? And do we see that behavior happening in other places where it maybe previously wasn't happening, or where we might not expect to see it? So for example, we might have a dog who in the vet room shows fearful behaviors, and then they start to show fearful behaviors on the way to the vet room or in the car if they have to be transported. So that behavior is starting to generalize outside that initial context that we saw the behavior. We then want to think about the threshold before behavior, and we're going to talk about this in a little bit more detail in a minute, but that's basically thinking about the distance or the intensity of the stimuli that the dog is reacting to. So our threshold is often kind of thought of as our doorway to the behavior starting to show in any given situation. We might think about the severity of behavior, so that could be how long we see signs of the behavior occurring after the stimuli has moved away. It could be the level of response we see. So for example, a dog who goes very quickly into, lots of barking and lunging if they see a certain stimuli, or it could be that overall picture of how severe that behavior comes across. And then we also want to think about what is the emotional state. So what is our motivation? Are we seeing distance increasing behaviors, distance decreasing behaviors? What evidence can we get from the dog to try and rule in or out some different emotional states like fear, frustration, and some of the other ones? And we're probably also going to consider our ABCs, so our antecedents and behavior and consequence. So what happens immediately before we see the behavior, and what's potential reinforcement or punishers that's occurring and adding to that situation. This is not something that I would necessarily do with every dog, but this is just an example of why it's really important that we do look at the understanding and the motivation behind behaviors, because it really helps us tweak our plans to get the best success. So this is a dog called Millie that I worked with last year. And she had been rehomed, and then she was returned to the centre, to the kennels, for reacting to other dogs. When she was in the first time, she was able to mix with other dogs pretty successfully with quite a range of different dogs. And then the reason she was returned and the presenting complaint was lunging and barking at other dogs on lead. Now, this setup is not ideal because, in typical shelter fashion, we were trying to take her to a large field to do some distance work, desensitization, and counter conditioning. And on the way there, we saw about 4 other dogs, and it was very stressful for me and Millie. So instead, we came into our training barn, which is the area you can see on the screen. And we started to do some latte, so some look at that, and then enrichment from Leslie McDevitt's Controlled and Leashed with a stuffed dog. So you'll see the stuffed dog coming in at the end. And based on some of the observations that we'd made and that history of her being able to mix with a range of other dogs first off, we were trying to investigate if frustration, so the inability to get to something that the dog wants, was one of the possible emotions behind this behavior. So what you'll see here is a little bit of focus, well, quite an intense bit of focus, but then she is able to redirect off and then move to the next station. So the aim with this, just briefly, we're not going into detail here, but is the dog goes to the station, and then obviously we see this reaction here. So we just redirect her. And then what I'm doing is just removing that sort of build up. And again, this is a stuffy dog. I wouldn't do this with every case. And it's hard to see because it's so far away, but we sort of get some really nice play bows. She was really relaxed, sniffing with the stuffy dog. So that might add some weight to that theory that frustration is playing a big part in Millie's plan. Now, the reason that this is important is if we spend a lot of time sort of protecting Millie from other dogs, increasing distance and teaching her to move away all the time, that might have a slightly negative effect on how quickly we can make progress, because one of the big motivations for Millie is actually having that contact with other dogs. So it might be a consideration that we build into our plan. This was another day, and there was a dog in a run that we knew really well. So it was a member of staff's dog who is really, really good with other dogs. And we sort of further investigated this idea. And there's no sound on the video if people are wondering that. They can't hear it. So we're doing sort of a calm approach. Should drop some treats in a minute, I think. Just encouraging some sniffing. And then the dog's in a compound off to the left. And again, we're just sort of moving fast. Apologies for my bad running. And you have to be careful if you're using fences or barriers, because it can cause frustration in itself. But we can see sort of it's hard because she's got a partially docked tail as well. But actually, after she has that initial stiff, she's not too bothered about being hyper focused on the dog or all of that interested, really. She's interested in what else is going on around. She is keen to see the other dog, but again, it's not sort of there's limited body language that would indicate that she's fearful or worried about that other dog, and she's pretty relaxed in the situation at this moment. So the next step then again was this is another dog that we've got who's really good with dogs, Tara. She's muzzled because of the legislation in the UK, not because of her behavior. And again, we're just sort of doing a bit of reward and redirect training with Millie. And then you can see again, she's kind of going up to the dog, but actually, because she's got that access, she's not that bothered about greeting, and she's able to move away really nicely. So it's still really important with a dog like Millie that we work on the reactivity at a distance, because that's ultimately going to be one of the challenges the owners face. But it means that we could add mixing into the behavior modification plan to address that partial need that she had for that social interaction. So it's just a case example of why it's really important that we consider that motivation and emotion behind the behavior. Other considerations that we might have with our assessment is, what equipment do we need? So does the dog do better on a harness or a front attachment harness? Do we need to double lead the dog if they're wearing a collar and a harness, or are we using a slip lead for safety? Does the dog need to be muzzled as part of their behavior modification plan? Are we doing flirt pole training, which means we might need a flirt pole? So thinking about everything that we need as part of our plan to move forward. We want to consider what behaviors are involved in the behavior modification plan. So we might have a focus on alternative or incompatible behaviors. So we want to start that before we move into some of the other work. So laying those foundations in our training before we then move on to doing things like desensitization and counter conditioning. We want to preference test the dog. So we want to understand, what is this dog going to find rewarding? For some dogs, that's food. Some dogs, it's toys or play with the handler. And obviously the food can have different value of reward, and it's not always as we expect. So sometimes the dogs can really like schmackos versus chicken, or vice versa. So we want to do some preference testing to understand how best we can reinforce the dog when we're seeing behaviors that we like. And then we also want to think about what, when, and where does the dog find learning difficult. So we might not look to do certain training near the block if they find that particularly difficult with a lot of barking happening. There might be certain areas of the centre, if you've got a real life space or a quiet office space, where the dog learns more successfully, and that could be the starting point for our behaviour modification plan. When we then move on to planning, this, like I said, is where we might use the 3R model. So the reason that I like this model is it's nice and easy to kind of explain and think about. And again, we do like a bit of an acronym in the training world. So we've gone for the 3Rs. So we've got our risk assessment, our reduce, which is basically our management. So looking to reduce the focused behavior occurring, and then resolve, which is where we're hopefully going to start to see that emotional and motivational change. So having a look at these individually then, our risk assessment, we're obviously considering the risk to others. So if it is a reactivity issue or an aggressive behavior issue, we need to consider what risk that dog might pose to others. We might also consider the risk to themselves. So if they are doing a lot of lunging, or if we're seeing bar biting or spinning in the kennel, is there any potential risk of injury there? We also want to think about the environment. So are they damaging the kennel, or can they not be left in the home because they're damaging things? We just want to make sure that we've got a good overall picture of what risks we might need to work on to support that dog through their behavior modification plan. And this can be a formal risk assessment. So you might have one yourself, or I know that Maddie's fund has done some work on risk assessments in the past. Or it could just be a short one that you do in your head. Really, it depends on your organizational policy and the type of behaviors that you're working with the individual cases. So yeah, we might think, when we're thinking about dogs who are on site in our kennels, we might think about the risks to potential triggers, like I've already mentioned, the risks to themselves. We should also really consider the risk of general stress. So what effect is having to work through a BMP with having on that dog? So if we've got dogs where they might be welfare compromised in kennels, we're going to struggle to progress complicated behavior modification plans, and that might be an element that we need to consider in our risk assessment when we're thinking about welfare. We obviously want to consider a staff safety risk, and when we're working with dogs in the kennel environment, we've also got that added complication of considering that risk of putting that dog back out into the real world. So we need to consider their rehomability and the risk they potentially pose if we're unsuccessful in completing the behavior modification plan. And that could involve a review of any previous incidents that have occurred that we have information about as well. When we then hopefully get that dog out into a home, that risk to potential triggers might still exist, and we need to consider that again. But also, how is this going to change in a new environment? So sometimes it can change for the better if we're rehoming dogs to those 1 in a million homes where they live in the countryside with nobody else about them. That might greatly reduce the risk. But if we're considering rehoming a reactive dog into a city environment, that's obviously likely to increase the risk. So just considering any new factors that come into that situation. Again, added complication of possibly considering reputational risk if we do rehome a dog and then there is an incident. And this is part of the reason that we do these risk assessments, is to make sure that we're confident in our decision making. And we're obviously going to consider the risk to adopters as well. So this is one example of a risk assessment that you might use, where you've got the severity of the incident on the left-hand side. So starting with a minor incident and moving up to potentially fatal. And then across the top, you have the likelihood. And you would rate the behavior in these two categories. And then that gives you a green, amber, or red score. So this is an example of one for a dog that I worked with previously. So you can see we've got the hazard, which is a bite to a person on a walk. We've got any relevant specifics. So this dog had had 2 bite incidents resulting in injury when out in the home. Sorry, I'm just going to move my zoom bar. We've got any influencing factors. So we did discuss pain due to some increase in sound sensitivity, and there's some research that shows that sound sensitivity is often linked to pain, and this was not present in the previous home. The first bite occurred with the garden and the owner, so we're just collecting information that might have an influence on that risk. Then we do our severity and our likelihood, and that gives us our score of 10. What's also important with a risk assessment is we then consider the mitigation. So what have we done to try and reduce the risk? So this dog was currently walked on a lead and muzzled. They have a desensitization and counter conditioning behavior modification plan, and they're doing well with that plan. So once that plan is completed, our risk is going to go from a 10 down to a 4. So that's just an example of risk assessments. When we consider our management, like I said earlier, this is basically looking to reduce the behavior happening. This is a real key to behavior modification being successful. If the dog continues to display the behavior that we're trying to change, there will always be a level of reinforcement happening there. That's why the behavior continues. So that's therefore possibly having a negative effect on the success that we're making. It's not always possible to completely avoid those incidents, and we're going to talk about that in a little bit in a minute. So our aim really is to just keep the dog's arousal levels to a point where they're still able to learn. Sometimes we describe that as below threshold, remembering that threshold isn't just a clear door. It's something that we might build up over time, and we've all got a varied threshold, and the threshold might also change depending on the environment. And it's also to help maintain safety for the risks that we've just talked about, but also welfare, because if we've got a dog who's constantly showing behaviours that might be described as negative, that's obviously a concern from a welfare point of view. If we're considering reducing behavior in centres, we might think of things like 2 handlers. So particularly if we've got strong reactive dogs, using 2 handlers can obviously help to manage that. It can also make things clearer for the dog. So one technique that you can use with 2 handlers is called brawns and brains, where it's really clear to the dog who's doing the training and where's the treats available. So we've got our brains who's doing training, they're carrying a treat pouch, they're doing most of the interaction with the dog. Often we'll use something like a fluorescent vest to make it really clear to the dog where the reinforcement is available from. And then our brawns is just there for support. They might be holding the main lead or a second lead, and they're just there if any concerns happen with the strength. It's particularly useful for dogs who might be grabbing or ragging on the lead, shaking the lead, or trying to get at handler's clothing. We obviously want to consider walking at quieter times to give the best chance for success. And we also want to consider barriers for any visual. So that could be to reduce behaviours of people reacting to people walking past kennels, or hiding behind a car if a dog is in the distance. So using a visual barrier to try and reduce the intensity of the stimuli. We might look at things like noise reduction to generally manage arousal, as well as reducing reactivity in the kennels, that sort of thing, or things that might be a little bit more active management, things like teaching a find it, using target bowls, so laying out bowls that are filled with a little bit of food to help the dog move forward and move to specific places. So we can put them from the kennel to the run, use a couple of target bowls, and that can really help the dogs move into that other space. And we might think about the location of the dog as well. So if we've got a dog who really struggles with reacting to the dogs next to them as they come out of a kennel, we might look to put them on the end so they've only got one dog next to them, or move them to a quieter block if you've got a couple of loud dogs in one space. When we think about moving this into the home, we might consider decompression opportunities to speak. So speaking to the owner about if there are any concerns, giving them the opportunity to settle down, doing lots of licking and chewing behaviors after an incident's occurred to again manage that arousal. We might talk about appropriate walking routes. So often a suggestion that we might make with reactive dogs is walking in graveyards late at night, because generally speaking, it tends to be where other people don't want to be. The people near me that live near me didn't seem to get that memo, and what tends to happen is all of the reactive dogs go to the graveyard at night, so you do have to be careful and consider having a conversation with the owners in the area. We might again think about equipment. So do we need to use a front attachment harness? What other management can we use through equipment? And we want to think about preparing the adopters. So that can often just look at showing what's previously worked. So showing them a find it in situ, showing them videos of management happening so they've got something to take away when they take that dog home. Because lowering that overall stress is going to, by managing the environment, the aim is to help keep that dog under threshold and support that success in the behavior modification plan. When we're moving on to our resolve, this again is where we want to see that motivational and emotional change that's then going to hopefully have a positive effect on the behavior. And the first step with our resolve is getting our dogs in a row. So making sure that we've done those two first R's ready and we've got everything planned, ready to move forward. We're ready for the plan. We know what we're doing. We know what our stages are, so we can move through them in a succinct way. Another consideration for this might be something like the hierarchy of dog needs from Linda Michaels, to make sure that we are taking that holistic approach, particularly when we're working with dogs in shelters and rescues. They're challenging environments to start with, so we want to make sure that we're trying to do as best as possible to fulfill biological needs, emotional needs, social needs, and then right at the top you can see those force retraining needs and then the cognitive needs in the purple triangle. So the reason it's a pyramid is that we need to build that strong base and foundation before we get to the point really where we're considering doing the more complicated elements of the behavior modification plan. When we then look to start doing the resolve, we're going to consider all training options available to us and rule them in or out depending on the dog in front of us, depending on the resources we've got available. So for example, we might consider using Look at That from the controlled and leashed games, or we might consider using BAT, behavior adjustment training. But if we don't have a huge amount of space and the dog's got quite a small threshold, BAT might not be the training plan that we choose to use with that individual dog. So we're considering all options available and just ruling them in or out so that we're left with the best, hopefully the best plan for that situation. We want to look at starting to build those foundation and coping skills away from the trigger, and then gradually we're going to start using our desensitization and counter conditioning in variation. So when we consider desensitization and counter conditioning, it's just the scientific way to say getting a dog gradually used to something and then changing how they feel about it. And there's lots of different protocols that we can use as part of that, like the LAT and the BAT that we've just mentioned. If you are a bit stuck with a dog or you're not very used to creating behavior modification plans at the moment, this can be quite a useful table. So it's come from Daniel Mills, who's at Lincoln and Helen Zolch's Stress and Pheromonotherapy book. So quite a hard word to say, but I just about got through it. And what you've got across the top is our different types of interventions. And then down the left-hand side, you've got kind of your different stages of the plan. So you've got your preventing the behavior, removing the trigger, modifying perception, changing behavior, and encouraging alternative activities. And then our categories are environmental, chemical, physiological, and physical. So environmental could be changing the location, changing your walking area. Chemical might be speaking to your vet about using behavior medication, or it could be using pheromones or different things like that. Psychological is where we're starting to include our training, and then physical might be our harnesses or tools that we're utilizing. So an example of this might be if we've got a dog who lunges at other dogs, we might use teaching a middle, so teaching the dog to go in between our legs and wait for the other dog to pass. We could teach a find it, or we could constantly feed primula. So primula in the UK is like squeezy cheese, like spray cheese, and you feed the dog constantly as the trigger walks past so that they're not reacting. So another opportunity to see if technology is on our side this evening. So again, you can scan the code and it should just come up with the new one, or if you've still got it open. And which of those three would you choose when you're working with a reactive dog? So teaching a middle, teaching a find it, or primula for the win. Okay, so somebody saying primula, a couple of people starting to use a find it. Oh, find it seems to be winning. So that's one consideration that we might use based on the information I've just given you. If I added the information that it was a Rhodesian Ridgeback who also had a habit of redirecting at the handler, we might expect the number of people that say teaching a middle to drop down a little bit, because having a dog who might redirect stood in between our legs might not be something that we want, particularly if we're male trainers. I'd definitely be opting for the find it or a primula in that situation. So obviously that's quite an extreme example, but you can see how you'd start to consider the information that you've got to rule in or out our treatment options. When we are then considering our desensitization and counter conditioning, the reason that we use both together is if we use counter conditioning just by itself, often the stimuli can be too intense. We can have the dog over that threshold that we've talked about, and that's going to affect how well the dog is learning in that situation. So our desensitization helps us to keep them under threshold and gives them the best opportunity to learn. If you haven't seen these before, this is quite a good way to think about threshold and the intensity we're seeing. So this comes from Grisha Stewart's book, the Behavior Adjustment Training book. And the idea is that dogs kind of live on this beach when we're thinking about arousal, and our aim is that we're keeping them on the beach and we're keeping them out of the sea. So we're aiming to work in this green or blue zone where we see that nice loose body language, soft mouth. They're not avoiding the trigger, they know the trigger's there, but they're just not really paying that much attention to them. We know that learning is optimized in this zone, and we've got to establish it via an assessment. So we need to really understand what sort of distance the dog can cope with if we're talking about reactivity. And we still need to make sure we're taking regular breaks and giving the dog the opportunity to stay on the beach rather than the stress building up over time. At some point, we're likely to maybe head into the yellow or amber area, and this really is where we're going to start to teach staff what to do when they start to see that level of arousal building. So things like the dog being able to disengage, but taking a couple of seconds to do that, or where the dog starts to be unable to disengage from the trigger, we might start to see the body or face stiffening, that sort of things that might indicate the dog's getting ready to react or struggling. I can see I can see Sheila's added the name of the books in, so thank you for that. And the stage that we're trying to avoid is this red stage where the dog's gone over their head in the water. They're underwater now. We're seeing those signs of reactivity, and we're not too worried about the training in this minute because the learning's likely to be ineffective. So we're just going to help the dog move away as quickly as possible, and then we might consider pausing the session or having a bit of a break and then continuing at a greater distance depending on how the dog's responding. When we're starting off a desensitization and counter conditioning plan, what we want to do is start with respondent counter conditioning. And the reason that we do this is it doesn't really matter what the dog's doing, we're just starting to create some emotional change. We're changing that previous negative stimuli into a positive one. So we're aiming to influence involuntary behavior. So we're not asking the dog to do anything, we're just rewarding the dog for not reacting, essentially. So we're starting to change that emotion, which hopefully is then going to change that drive for the behavior. We want the dog to be below threshold, like we've already talked about, and then we're going to introduce the trigger. In this case, we're going to just use dog-to-dog reactivity as the example, but this could be any trigger that we're working with. And our criteria for reinforcement is just that the other dog is in view. So the other dog is present, our dog has acknowledged that their dog is there, so they might have a little head turned towards them, and the dog's there. there's no contingency on behavior. So we're not expecting the dog to do anything specific. They're just being fed whilst the trigger is in view. Sometimes that can be referred to as like open bar, closed bar. But the general idea is if the dog can see the trigger, they're being fed yummy treats or they're having a play, anything they can enjoy. We know this can be tricky in the kennel environment because it's hard to avoid dogs, but what we can also consider is this being a bit of a bank account. So we're constantly adding positive deposits in, which hopefully means if we do take the dog over threshold accidentally, or we're unable to completely manage the situation, the dog's not going into their overdraft. They're able to have a bit of a buffer of those positive emotions. So this is an example with a dog called William. Sorry, I forgot his name then. So you can see he's just being fed in the presence of the other dog. And it doesn't really matter what he's doing. So he is looking at the other dog and then looking back at me. But the criteria is just when the dog's present, he's being fed. And then when the dog disappears behind the van, the food stops. And what you generally end up with is a dog that just stares at you because they want the food and they're not bothered about the trigger anymore if you're at the right distance. But obviously the dog knows the trigger is still there. They're aware the trigger's present, and that's your main thing really. Is we want to make sure that they've seen the dog before the food starts coming. For our next steps, we're going to shift into operant counter conditioning. So this is really where the behavior starts to become important, and this is where our pre-training fits in. What the dog is doing, oh yeah, I've just said that. And then easy move, it's an easy move from respondent counter conditioning because generally speaking, if you're feeding a dog when a trigger is present and then you stop feeding the dog, what's going to happen is they're going to naturally reorientate towards you or turn back to you and say, excuse me, where's the rest of my food? And that's your opportunity to mark that behavior. And then you've started to build up a little bit of look at that training, or you've started to get a little bit more engagement from that dog naturally by reducing the amount of food that you're giving them in the situation. So this is what that can look like. So you've got your dog in your distance, you wait to see that change in behavior, so they look back at you or change in body language, and then you do your mark and reward, and then you repeat until the other dog is out of view in the same way that we did with the respondent counter conditioning. If we have taught a differential reinforcement of alternative or other, this is where this comes in as well. So we see the dog in the distance, we ask for or we wait to receive the alternative behavior like the orientate towards handler, a sit or a hand touch, and then we mark and reward and continue as we described earlier. And obviously these aren't the only training plans we might use, this is just an example. As we mentioned earlier, we want to teach any alternative behaviors away from the trigger to start with. So this is William, again, being taught a sit inside, away from any triggers, where he's comfortable and relaxed. What I will say is, again, I don't often use a sit for reactive dogs. The reason that we did is, A, it made it really easy for the videos to show you what we're talking about. And B, William is just quite frustrated. So he sort of struggles with being able to get to the other dog. He's quite a big lab. He was quite strong and stocky. So the reason that we taught him the sit was it meant that when he then went home, he was able to sit on the pavement as another dog walked past. So it wouldn't be my choice training plan for every dog who shows reactivity behaviors. But again, it's just a nice example. So we're teaching the sit inside, away from triggers to start with. And then we combine the two things together. Terrible habit of having my hand in the treat pouch, so don't copy me doing that. But we see the trigger and then we wait and see if William will do his nice sit. And then we gradually reduce the distance depending on the behavior that we're seeing from the dog. So he's still being cued at this point, and it's kind of up to you really if you want to use a cue. Best case is that the dog naturally starts to do the alternative behavior as they see a trigger, but when you're starting out, you might need a cue to just help them out. So he's still allowed to look, he re-engages, and then we get the sit. Good boy. Okay. As I briefly mentioned earlier, it's really important that we get that order right as well. We want to make sure that we're cueing the incompatible behavior, or we're waiting for the dog to orientate after they've seen the dog. If we just start feeding the dog but as soon as we see the dog and our dog hasn't noticed them, that isn't training, that's management, because we're not allowing the dog to identify or see the thing that they're a bit worried about or frustrated by. It's appropriate at times. There might be times where we do just want to feed the dog continuously as something walks past us, but ideally we want to be progressing them on so that owners aren't having to do that every time they see a trigger. And sometimes it goes wrong, and that's fine. And this is an example of that happening, and I'm just going to talk through it a bit. So just so you're aware, there is barking in this video. So if you have other dogs around, it might be an opportunity to just reduce your volume a little bit so that we're not distressing them. So this is a dog called Toby that I worked with a few years ago, who is reactive to other dogs. He lunges and barks, and we were doing a really lovely session that was going really well. And what you can't see is just off to the side, there's a compound. So there's an exercise space for dogs, and somebody put a dog into that run. And due to that, Toby started to react on Stooge dog, Buffy, who is obviously nice and still quite relaxed. I will say hindsight is 2020, and I definitely would have increased the distance further than I did at this moment. But we're not freaking out. We're just taking it as it comes. We've increased distance. I test to see if Toby wants to start taking food again, which he doesn't. So again, I should have moved further away. But I start to do a little bit of light touch to start to hopefully bring that arousal down. Again, it's knowing your individual dog. We're still getting a lot of barking, so we're just moving a little bit further away again. Buffy's doing some really nice find its with her handler. I ask for a known behavior and see if I can get any engagement from the dog. And then we start eating again. So we're constantly assessing the situation, saying, right, do I need to stop the session, or can we see what we do? We start to get a little bit more relaxed body language than we had previously. It's not perfect. So we move a little bit closer again. We don't start to see that barking come back. I think we get one or two barks in just a second. There we go. So again, then starting to employ some of the skills that we taught Toby outside of this session, like the come away, come with me, and then moving in a slightly different way to try and get Toby re-engaged in the session. He goes back to eating, responding well, and being more calm than he was to start with the other dog. So again, it's not an ideal situation that we would do every time, but it just shows that sometimes we need to think about the session and whether it's worth continuing, or whether we just need to get the dog out of there and change the plan, reassess, give them an opportunity to chill out, and then consider where we are next time. A big part of behavior modification plans, like we mentioned, is our prognosis and expectation setting. So it's how we manage how the dogs move through their plans in the most effective way possible. And a system that I really like for this is called SMART targets. So some of you might have heard of that before. It's quite common in sort of human management and leadership training, and it stands for specific, measurable, achievable, relevant, and time bound. And we're going to look at these in a bit more detail as they apply to dog training. So with our specific, it's increasing the likelihood of us achieving what we're setting out to do. So if we say we want the dog to stop being reactive, that's such a massive category, and it's possibly unachievable. Like, we might never get there with the dog, or at best, it's likely a long way off. So we really want to consider what effect that has on our staff if we're unable to achieve that goal, or adopters if we're working with adopters. So instead, what we might do is think of things like, I don't know why I got stuck on that slide then, sorry. we want to think about things like, oh, well, I want my dog to walk to heel for a specific distance. So between here and here, the dog's going to walk near me on a nice loose lead. Or I want the dog to be able to go to his bed rather than stop barking at the door. So we're thinking about the specific behaviors that we want to see rather than the behaviors that we don't want to see, like pulling us all the way to the park or barking at the door, like I've just mentioned. So we're trying to be a bit more specific in our aims so that we are getting that clear understanding of what we're trying to achieve. When we're moving on to our measurable, we need to consider what our baseline is. So we need to know where we're coming from so that we can assess whether it's getting better or not. We want to also consider how often are we going to review. So when are we going to look at this every 2 weeks? Are we going to look at it once a month? Because that might affect how we measure what's going on. And there's different options that we can use for measuring. There's things like the 0 to 5 scales, where you rate from really positive or slightly positive or neutral. So it's a 5-point scale that you would rate the progress of your training session each time. And then obviously you can see how effective that is. You can do better, worse, or the same. So again, that gives you a more general overview of if the dog's improving in their training or they're taking a backward step. We can use the 3Ds, so our distance, distraction, and duration. Are they improving each time or over a number of sessions? If you want to be really geeky, it's a little bit much for me personally, but I do know some people that count the number of clicks so that you know if you're getting success in your training session. If you do one 5-minute training session and you only get 3 clicks, and then the next one you get 10 clicks of a clicker, you know that the dog is achieving the goal a lot more. And we can also use diaries and videos, which really is the most realistic way to achieve this in rescues and shelters, is using diaries, videos to capture that information and then review it after the fact. We want to make sure that these things are achievable. We want to be realistic based off the information that's in front of us. If we're working with owners, we want to think about how much time can they actually give the dog during the day, and same with our kennel staff. If we're saying we want the dog to be muzzle trained in the next 3 days, but actually there's lots of adoption appointments and we're only actually going to have 5 minutes to work with that dog, that's never achievable. So we're going to set our staff and the dog up for failure, which is obviously something that we don't want to do. When we're considering working with adopters, we want to make sure that our plans match their life, and we're going to talk about that in a minute. And we gradually want to increase our criteria. We have a process at the organisation where I work called timely review. So every 4 weeks, we review every dog in our care and we rate them on a 5-point scale. And we set action plans. Well, if we set an action plan of not reacting to other dogs in the first session, that's probably going to roll over to a number of timely reviews. But if we say, find a reinforcer the dog really likes, be able to not react to a dog at 50 feet away, we can see that progress as we move through those timely reviews. So really considering what options we're able to give. And we also want easy wins. So if we're teaching a dog to go to a station, the easy win might be find a mat that you can use with the dog and put the dog's name on it, so that we're building in reinforcement for our staff. We all love a to-do list where we're able to tick off the thing that we wanted. We want our training to be relevant to the thing that we're working with. So again, we're not wasting time. And this is a terrible analogy for a dog welfare presentation, but we want to look if we can kill 2 birds with 1 stone. So we don't want to duplicate any work that we're doing. We want to make sure that we can best utilize any skills the dog already has as part of our behavior modification plan. So we had a dog called Milo, who was a Cocker Spaniel, who really struggled to have a harness put on. So we taught him to sit on a station. He was very fizzy, get really excited when people entered the kennel. So we taught him to sit really calmly on a station. And he did that for a number of months and built up a really positive association with that mat. He then developed a veterinary problem and didn't particularly enjoy being handled by the vet. So rather than having to start completely from scratch with a veterinary handling program, we just used his mat, which we'd already spent a lot of time creating a positive association with. So that really helped us with the progress we were able to make. We also want to think about what we're trying to teach. So I remember a discussion on Facebook a few years ago where somebody was saying, can we do a desensitization and counter conditioning plan for two dogs who resource God from each other, so they fight when they're having food? And I said, well, yeah, technically you could put the bowls really far away, reward the dogs for being calm next to each other, and gradually decrease the distance. But in the meantime, what we're going to do is ask the owners to feed them in two separate rooms. That's going to be our management for safety. And for most owners, that's going to stop the fighting and they're not going to bother to do any training because they've achieved their goal. So we also want to think about what's relevant for the moment. What we think is relevant might often not be what the dog specifically needs or what's relevant to that owner. So we just want to make sure that we are working on relevant things and not just throwing in training plans because we're not sure what to do. We want to make sure that our goals are time bound as well. So when are we next going to be in contact if we're working with an owner, or when are we next going to review the training with our staff? It could be something like, can you record a video in the next 2 weeks? So I did that with a member of staff this week. We're working on a handling program with a dog. We did some live coaching with videos. And then the goal was, in 2 weeks' time, can you send me another video of your progress? But obviously they can get in contact if they need to. When are we going to compare back to baseline? So this is really important as well, because even if we're seeing small wins, sometimes it can feel like the wins are really tiny, we're not making much progress, or the dog's plateaued. But until we look back at where we started, it's hard to sometimes see how big a difference we've made. Because if we're constantly looking at it, it can be quite tricky to actually think, oh, the dog's only just started targeting the muzzle, or they're holding their nosing for 5 seconds. But actually, the first few times we showed the dog the muzzle, they ran away and hid in the corner. So we've got to keep everything in perspective because we know we're working with often challenging dogs in a very challenging environment. So again, we need to make sure that our staff are engaged and feel like they are achieving something when they're doing training with the dogs. And we also, when we're considering time bound, does this work with owners and staff? So are we putting a BMP in place today when it's 5 days before Christmas? Because we know realistically we're probably going to have limited interactions during the Christmas period. There's going to be other things going on that we need to prioritize. We might have skeleton staff. So actually, rather than reviewing in 2 weeks, we might review in a month's time to get the Christmas period out of the way. It might be that there's important work tasks going on. So we've got outbreak of a zoonotic disease and we're having to do barrier nursing for other dogs. So again, we might not want to put a lot of time-bound conditions on the dogs in our care. Obviously, I know that's not always a possibility. We're always kind of fighting against time and space, but these are things that we should be considering if we are trying to work with some of the more complicated dogs. If we've had a large intake of difficult dogs, all of the stuff that we know can affect how much time we're able to give individual dogs in our care. And when are we going to review changing things if it's not working? So if we've done 3 training sessions and we're not getting the success that we want, we might need to consider, do we adjust what we're doing? But we need to know when we're doing it, because we know learning can take a little bit of time. So we also don't want to chop and change things willy-nilly, which again might affect the progress. So we might think, right, okay, we've done 2 sessions, they haven't gone very well. Let's do another 2. And then if we don't see the success that we want in those 2, then we'll look at modifying the plan and seeing if we get better success then. So understanding that at different points for our training session really allows us to hopefully make the change at the most appropriate time for the dog and the handler. So we've looked at what BMP is, we've considered how we approach BMPs through that happier lens, and we've talked about those different elements, and then we've thought about SMART goals for our behavior modification plans. So hopefully that's given you some ideas around how we can help dogs in our very challenging environment and how we can build those plans up from the ground up. And I'm happy to take any questions that you might have. I've also got a link to the QR code here that takes you to the podcast and the Facebook page if you are interested and you want to learn more about behavior in shelter dogs.
Great.
Sheila's as well. Thank you.
Thank you so very much, Tom. You covered so much information in such a short period of time. It was wonderful. I am going to jump right into some questions if that's okay.
Yeah, cool.
So, if you don't usually use sit, what is your go-to incompatible behavior cue for reactive dogs?
That's a great question. I would say again that universal behavior answer of it depends, and it has changed a lot over time. Um, Generally speaking, now I actually opt for an automatic reorientation, so the dog choosing to look back at me without a cue. But I'll also make sure the dog knows their name because personally, I think owners like to have something to do. So they struggle with the idea of you just wait for a dog to turn around. So I like the dog knowing their name. And then if they are getting a little bit stuck, if we're reaching that 2 second point of looking at the trigger, we can just say their name to get their attention back to us. But ideally, I think it should be automatic because that just means we know the dog really knows what is expected of them. We're seeing that emotional and behavioral change happening. Um, and it means owners eventually going to forget to cue the dog. So if we have it automatic, it's just more successful, but it takes that extra level of sort of skill and awareness.
Great, thank you. Our next question starts with, I missed the first few minutes. Is the intent to create and implement the described BMP for all shelter dogs? If not, what is the criteria for deciding to create and implement the BMP for a specific dog?
Yeah, another really good question. I don't think all shelter dogs need behavior modification plans. It's obviously going to depend on the reason that they've come in, the type of behaviors that we see during the assessment, and also your organizational policy and thresholds in themselves. So, the organizations that I work with, we generally do quite a lot of behavior modification plans. But again, we might have some dogs that are just on training plans, so they might need loose lead walking, for example. But if we see behaviors that might make a dog more challenging to rehome or where there might be a risk associated, we generally try and approach that with the more sort of widespread behavior modification plan rather than just using training by itself.
All right, thank you. Next question. We are seeing many examples of BMPs with reactivity, but are there severe behavior issues for which you do not even attempt a behavior modification plan?
Yeah, tricky question. That is definitely the all answering question of it depends. It really depends on your organization, based on A, what you're comfortable with, what you consider a rehomable dog in the future, what resources you've got available. Because if we are seeing really intense, potentially dangerous behaviors, and we don't have resources to successfully implement behavior modification plans, we have to consider the welfare of that dog, the long-term stay of kennels, all of the other factors that I know everybody's thinking about all of the time, to make that decision about if that's something that we want to do or not. It's a conversation that I have regularly with a lot of the shelters that I work with, because we've also got to be aware that our resources change. So if we have a lot of staff who are go off on sick, or we lose a lot of people and we need to recruit more, or because of recruitment our skill set might be slightly lower, we might not work with some of the dogs that we would have worked with before. So it's kind of an ever-changing landscape. But I think it's really important that you sit down as an organization and have these conversations and think what you feel comfortable working with. And then also really think about the prognosis setting in terms of, if we're not seeing progress, at what point are we going to review what welfare outcome might be appropriate for that dog?
Thank you. I think such a valuable answer, talking about regularly thinking about your resources and recognizing that if you're trying to operate within your capacity to actually help, things change and you need to modify what you do based on that. So thank you for that answer. Next question is also a little related to all that. And someone wants to know the staff ratio to dogs that you have at your centers.
Yeah, again, it depends. So I work with a number of different centers within one organization and a number of other organizations as well. So it really varies. Um, in the UK, we do have something called the Association of Dogs and Cats Homes, which is like an umbrella organization that a number of rescues and shelters are part of. And their recommendation for like ultimate welfare is something like one member of staff for every 8 dogs, but there's actually very few rescues that achieve that. It's normally sort of 1 to 12, something like that. But again, it does vary. There's some rescues that I work with that it's like 1 to 20. But again, we sort of get into that question around welfare then, and what we can achieve.
Thank you. You mentioned adoption appointments. At our shelter, the public come in freely. Do you do appointments only?
So the main organization that I work with, we've recently changed. So we still have open kennels, so people can come in and look at the dogs that are on view. Not all of the dogs are, but some are. So people can still come in, but generally speaking, we also then try and encourage them to book an appointment, particularly if it's a behaviorally challenging dog, because we want to make sure that the right person is there to speak about the dog, somebody that it can be their champion, but also give all of the information that's needed, or they might need to be shown some training, or part of a BMP, depending on the dog in front of them. So we do a mixture really. We do open and closed adoptions.
Thank you. Next, I know every dog is different, but if you could say on average, how long does it take for the reactivity training you demonstrated to start making headway in the behavior? I ask because I'm wondering if there's a point that we should realize it's not the best approach and we should try something different.
Yeah, it's a good question. I think generally speaking, sort of 2 weeks is a good assessment point to see if we're starting to make progress, not to make giant leaps. But I would say if you've been doing the same thing for a week or two and you're not really seeing any difference, we might want to consider the different parts of the BMP. So are we actually far enough under threshold for that dog? Do we need to spend more time looking at those hierarchy of needs, the foundation behaviors, or alternative things that we're doing with the dog? Or do we need to consider a different approach, completely a different protocol for the training? So you need, like I said in the presentation, you need enough time for it to embed, but our time is so precious in shelter that we also don't want to be working on something that isn't getting the results that we need. So I think sort of a week or two gives a little bit of flexibility with staffing and rotas and all of that stuff, and people changing, to kind of give us a little bit of an answer with that one, but it is a hard question.
For sure. All right. Next is how do you encourage time working with and compliance from shelter staff?
I mean, that's like 4 webinars by itself, I think. Um, One thing that one of my centers has done that's been really successful is sort of gamify it a little bit. So I know that's a bit of a buzzword at the minute, but what they did was put everybody into teams, and then the teams were able to earn points for doing different things. And some of those were easy wins. So it was like take a cute photo of a dog and send it to the media team, or give the dog a piece of enrichment and take a photo. And then you earned more points if you did muzzle training with the dog or this, that, and the other. And they sort of had like a little team captain who had maybe a little bit more experience with training that was also there to support them. And they built that up. And we spent quite a lot of time talking about what the reinforcer for the staff would be when if they won the competition. We talked about food, but actually some of the human research shows that food might not be like the best option for staff engagement and reinforcement. So it could be something like having 5 minutes extra of a lunch break or finishing slightly earlier. That sort of thing might be reinforcing. But I think the easy wins part of that answer is the most important point, like making it as easy as possible for people to feel like they're achieving something so that they then continue to do it and it builds and builds and builds.
I love that. Thanks. And it sounds like we need to have you back for another webcast on this topic because it's so interesting and we all struggle.
Yeah, definitely.
Yeah. All right. Two more questions. We have dogs in and out of our center to and from foster, which means we have both staff and foster caregivers following behavior modification plans for the same dogs. We're struggling to figure out how to get accurate notes from foster caregivers specifically. Do you have any advice for coaching non-dog professionals on taking accurate and thorough behavior modification and training notes?
Yeah, great question. I think considering some of those options that we talked about briefly in the webinar, so things like can you just use better, worse, the same? So we're sort of we are reducing the amount of information, but we get that better overall picture of if things are improving or not. Big thing is videos. Like if you can get people to video every second session or every third session and send that in, that just is going to give you that information much more clearly. It's obviously time intensive because you've then got to watch those videos, but most people have a smartphone now, which make it so much easier to gather videos. But really think about what you actually need to know as well, because I think sometimes if we just give open-ended questions like, how was the training session today? You get a lot of information about, like, they found a really great spot to sniff and they were sniffing this spot for 5 minutes, so we didn't actually achieve any training, which might not be what you actually want from that data if you're then sitting and reading all of these points. So I think the scales can be really useful. And ultimately, it comes down to the training that you're able to provide the foster carers. So if you can do like a short video about the sort of information you want that you can send out and they can watch back, that can be really helpful as well.
Great, thank you. I am going to paraphrase this next question a little bit. It's another question related to resources. And so many organizations are very resource limited. And the question is, can someone who only sees a dog occasionally implement some of these techniques? Is something like, if you can only do this once every 2 weeks, is it worth it to even try?
Yeah, I think anything that we do with the dogs, as long as we're seeing some positive response from the dogs, is beneficial. Like at minimum, it's enriching for the dog. It's something different that they're going to get enjoyment from. We can consider that bank account element as well. So everything that we do with the dog is having an impact on something. If we're not doing it regularly, it might just take a lot longer to achieve what we want. Something that we've done specifically related to that problem in the past is we've sort of split out training plans as part of our BMPs. So, for example, everybody might do muzzle training with a dog. It might be like the block's responsibility to do the muzzle training, so that's happening every day. But they might have a specific handler that's working on the vet handling, for example, taking the dog into the vet room. So that might happen less frequently, but other people are working on other elements so that we're still seeing some progress. So thinking about if we can break things down, but ultimately, like you said, Sheila, we're bound by the resources we've got available. So anything that we are doing is normally beneficial. We've just got to be aware of the prognosis and the ability to reach those goals when we are using a system like that.
All right. Thank you so much, Tom. This was absolutely wonderful.
Thank you very much for having me.
Sure. And thanks to all of you for watching today's webcast.